Here's another big story we are tracking: coronavirus. The World Health Organization gave us an update earlier. The Canadian doctor who is part of the team investigating coronavirus in China just in fact returned from Wuhan. Despite concerns the virus is spreading, he praised the work being done in China.
A phenomenal collective action and cooperation by the people of China to this response. And the interesting thing is, people have commented on that and say, oh, that's easy in a society or a political system like China. It isn't. It's never easy to get the kind of passion, commitment, interest, and an individual sense of duty that it's our duty to help stop this virus. I mean, we spoke to hundreds of people in hotels, on trains, and planes who are quite outside the system, and they all shared this sense of responsibility, accountability to be part of this.
Although there are dramatic new cases of coronavirus, the WHO has not declared the spread of the virus a pandemic. And what exactly is a pandemic? Well, the WHO defines it as a consistent spread of a new disease around the world where people have not yet gained immunity to it. A team from the WHO is in Italy today, meeting with officials there. That country is the hardest hit by coronavirus in Europe. Officials have set up checkpoints. It's all part of an effort to contain the spread of the virus. CBC's Renee Filipponi is at one of those checkpoints near Milan.
Well, Suhana, there are places like this, 35 checkpoints, in fact, across the region in northern Italy, stopping people from getting in and out of the red zone. The red zone is the community just right behind me. And these officers, there's 500 of them doing this across the area, are here stopping people. We can have a look over here on this side. When cars pull up, these officers go to the front door. They talk to the driver. They ask what right they have to be coming in. If they do have official permission and they're here to deliver goods, they'll let them through, but then they're going to need permission again to get back out. Now, we've also seen people who have friends or colleagues inside the red zone who have shown up here. There was a man, one of his work colleagues is on that side. He showed up, dropped off a bag over here. They couldn't even get too close to each other when his colleague came, picked up the bag, went back in the red zone. He says, you know, this has been really challenging. He hopes the measures they're taking will contain the virus, but for the people in these communities, there are so many unanswered questions. They don't know how long they're going to be in there for. They don't know if they'll run out of supplies, and they're just really worried about how bad this can get.
And I mentioned Italy is the hardest hit country outside of Asia. Renee, what is the explanation for that?
Well, that's the big problem here, Suhana. No one really knows exactly why Italy has been hit so hard, and that's what World Health Organization officials are really trying to figure out. They need to determine who patient zero is, how the coronavirus got into this part of Italy, and how it spread. And until they can find that out, they're not able to come up with a different method to contain the disease that may not be as dramatic as this. So they're trying to find those answers. In the meantime, health officials here are also meeting with health officials in countries that border Italy to try to come up with solutions to work together to try to stop this from spreading further into Europe.
That is CBC's Renee Filipponi in Milan.